exploring unknown tech, decoding future unicorns. Welcome to Product X, using the sharp intuition of capital and the hardcore logic of an architect to help you catch the next big event in the global tech sphere. Hello everyone, I'm Rena. Daniel Ek, Spotify's co-founder, alongside his partner Hjalmar Nilsson. They've built a futuristic checkup cabin armed with over 70 sensors that captures 50 million data points in just 10 minutes, no MRI, no months of waiting. Vivian, with the entire US, hyping full-body MRI scans from Preventive costing $2,000 to $3,000, and Lightspeed, leading this massive $700 million round into Neko Health. Is capital just buying into the Spotify founder's halo? Or have they discovered a massive financial calculus that traditional medical exam institutions haven't figured out?
Hey Rena, hey Nolan, hey everyone. Yeah, I'm an angel investor at Pre-Angel Fund, and honestly, when I saw this round, I immediately wanted to dig into the unit economics because $7 billion at Series C is no small bet.
Hey Rena, hi Vivian. Yeah, I'm a former Silicon Valley big tech architect, and I've been following Neko Health's tech stack for a while. There's some seriously interesting sensor fusion stuff happening here that I want to unpack.
So let's get into it. Vivian, I want to start with you. Everyone's talking about how Daniel Ek is applying Spotify's streaming subscription logic to healthcare, but what's the actual financial math here? How does a $300 scan fee translate into a $7 billion valuation? And is this model actually scalable in the US?
Great question. The key is understanding the high throughput arbitrage. In Europe, Neko charges about €300 per scan, and each scan takes only 10 to 15 minutes. Compare that to Preventive or Ezra in the US, where a full-body MRI costs between $1,000 and $2,500 and takes a full hour. Let's do the math on a Neko clinic. Because they don't need superconducting magnets or liquid helium cooling like MRI machines do, they can fit a dozen scanning cabins in a single storefront at a fraction of the cost. One Neko clinic can easily handle 10 times the daily volume of a traditional MRI clinic. That's the first piece, exponential equipment utilization.
Yeah, and I'd add that the hardware architecture is fundamentally different. MRI machines are these massive, expensive pieces of equipment that require huge capital expenditure and specialized operators. Neko's approach using 70-plus multimodal sensors, including computer vision, thermal imaging, and laser vibrometry is much more modular and scalable. They can deploy these cabins in retail locations, not just hospitals.
So the throughput advantage is clear. But Vivian, here's my question. Daniel Ek's real genius with Spotify was the subscription model, the recurring revenue. How does that translate to health checkups? Are people actually going to come back multiple times a year?
That's exactly the point. From day one, Daniel Ek never wanted to build a scan once and done business. The $300 price point makes the middle class willing to scan annually, even BI annually. And here's the kicker. Neko recently integrated with Apple Health and smart wearables. When your daily heart rate and sleep data fuses in the cloud with high-precision cabin scan data twice a year, Neko becomes your personal health data life cloud. Once your health baseline is anchored to their servers, the switching costs become terrifyingly high. That's the SaaS-ification of preventive healthcare, high frequency, low cost, data-driven.
And technically, that's where it gets really interesting from a data perspective. When you have longitudinal data scans twice a year for 5 years, plus continuous wearable data, you're not just looking at a snapshot anymore. You're looking for signal drift over time. The AI can detect microscopic changes that would be impossible to catch in a single scan. That's the real moat.
Nolan, I want to dig into the technical side. A lot of traditional medical practitioners are skeptical. They're asking, if you don't use MRIs, how can you detect deep tissue diseases? What's your take on whether Neko's sensor-based approach can actually deliver diagnostic quality results?
That's a great question, and it represents a misunderstanding of modern sensor engineering. Neko's technical philosophy is inferring the pathological state of internal systems through ultra-high precision sampling of multi-source heterogeneous data on the body surface. Let me break down the 3 technical modes. First, the ultra-fine-grained skin mapping they use. Over 2,000 macro photographs to build a 3D coordinate library for every mole on your body, even ones as small as 0.2 millimeters, combined with infrared thermal imaging to capture subcutaneous thermal anomalies. Second, laser vibrometry. This is a military-grade technology adapted for civilian use. They measure micro-vibrations on the skin surface with micrometer precision to calculate arterial stiffness and cardiovascular efficiency without ever touching the patient. Third, the Bayesian multimodal data fusion when you combine optical data, thermal data, vibrometry, and blood test results. The joint probability of detecting something suspicious becomes much higher than any single modality alone.
Wait, can I jump in there? That's exactly what makes this investable from my perspective. The false positive problem in preventive screening is huge. If you scan someone and tell them they might have cancer when they don't, you've created massive panic and unnecessary follow-up costs. But Neko's Bayesian approach means they're looking at multiple independent signals. If laser vibrometry shows slight arterial stiffness and blood tests show mild inflammatory markers, neither fatal on their own, the joint probability triggers a high-risk alert. That's much more reliable than a single MRI image.
Exactly. And the results push to the on-site physician's iPad within minutes. That's the closed loop from walking in the door to hearing a diagnosis.
So we've covered the financial model and the technical architecture. But here's the big question: competitive dynamics. You've got traditional primary care on one end, full-body MRI players like Preventive and Ezra on the other, and now Neko entering the US. How does Neko position itself? And can they actually win against established players?
This is where it gets fascinating. Traditional primary care relies on stethoscopes and basic blood tests, highly subjective, struggles to catch early hidden threats. Preventive and Ezra focus on deep tissue tumors via full-body MRI, targeting affluent classes with $1,500 to $2,500 scans. Neko sits in a completely different ecological niche. They focus on early cardiovascular, metabolic, and dermatological screening, not the same thing as finding a tumor. Their $300 price point and 10 to 15-minute scan time creates a mass market entry point. They're not replacing MRI scans. They're creating an entirely new category of preventive health tracking that people can do annually.
And from a technical standpoint, the sensor approach gives them data that MRI can't capture. Laser vibrometry for arterial stiffness, thermal imaging for inflammation, continuous wearable integration. These are modalities that traditional MRI just doesn't provide. It's complementary, not competitive.
Okay, let's talk about the $700 million war chest. They're charging into New York and the broader U.S. market. What's the biggest challenge they face from both a business and technical perspective?
The scaling challenge is real. They need to replicate their European model in the U.S. market, which has different regulatory environments, different healthcare payment systems, and different consumer expectations. The unit economics work in theory, but execution is everything. Also, building enough clinics to create that network effect, they're banking on it, takes time and capital.
The biggest engineering challenge, honestly, is going to be interpretability and hallucination control. When you have 5 years of longitudinal data and the AI detects a microscopic signal drift, say skin pigmentation darkening by 5% over 3 years while LDL cholesterol rises, you need to deliver a causally interpretable report that convinces both doctors and patients. You don't want massive over-medicalization and patient panic from false positives. Conquering that is the ultimate moat they must cross as they transition from tech geeks to serious healthcare institutions.
That makes sense. All right, let's do our lightning round. Quick fire questions, quick answers. First one, Neko Health in one word.
Disruptive.
Scalable.
Second biggest risk to the business model.
Regulatory capture. Healthcare is heavily regulated and entering the U.S. market means navigating a minefield of compliance requirements.
False positive lawsuits. If the AI tells someone they're healthy when they're not, or the opposite, the liability is enormous.
Third most impressive thing about their tech stack.
The multimodal sensor fusion. Combining 70-plus data sources into a coherent diagnostic output is incredibly hard.
Laser vibrometry. Adapting military-grade technology for civilian preventive care is genuinely innovative.
Fourth, will traditional healthcare giants try to copy them?
Absolutely. But copying the hardware is one thing. Copying the data moat and the longitudinal AI models is another. That's a multi-year head start.
Yeah, and building that sensor ecosystem from scratch takes time. It's not just about the cabin, it's about the entire data pipeline.
Final question, if Neko succeeds, what gets disrupted the most?
Primary care. Not the entire thing, but the routine checkup and preventive screening portion gets completely eaten.
I'd say the wellness industry. Everything from corporate health programs to consumer wearables gets elevated to medical-grade diagnostics.
Okay, let's wrap up. Vivian, give me a one-sentence summary of what we covered today.
Neko Health is attempting to SaaS-ify preventive healthcare with a high-throughput, low-cost, data-driven model that could fundamentally change how we monitor our health, but the execution risks in the U.S. market are significant.
From a technical standpoint, their multimodal sensor fusion and Bayesian AI approach represents a genuinely novel diagnostic methodology that could enable early detection at scale, but interpretability and false positive control remain the critical hurdles.
Thanks to both of you. From the Spotify legend that disrupted music streaming to this massive bet charging into U.S. preventive medicine, Daniel Ek and his team have demonstrated the absolute shock and awe of an asymmetric, cross-industry strike. Traditional healthcare waits until we fall before helping. Neko, armed with lightning-fast sensor arrays and Bayesian AI, is transforming health management from an expensive gamble into precise, daily data dialogue. When technology is positioned ahead of disease onset, prevention becomes the trump card everyone can hold. Thanks for tuning in to Product X.